Tell me about your passion for healthcare and what steps you have completed.
I've gone to places as the IHS director that no other IHS director has visited. And that set the stage for, I would say, one of the most transformative approaches from the federal government's perspective, that we can work side by side with each of the 574 federally recognized tribes in their space for their tribal communities the way they want it.
Hello and welcome to the Degrees of Success podcast. I'm your host, Freda Richards, and today we have the great honor of having Miss Roselyn Tso join us. She is the Director of Indian Health Services. She's also a member of the Navajo Nation. She has a great passion for enhancing healthcare for all Native Americans. And of course, she's a University of Phoenix alum. Help me welcome Miss Roselyn Tso. Tell me how you grew up, what your childhood was like, and where you're from.
So I'm from a little town in Arizona. It's called Page, Arizona, northern part of the state of Arizona. I grew up there. I grew up on the Navajo reservation. I am the daughter of a Korean War veteran. I am also the daughter of a long-time minister on the Navajo reservation. And then my father was a rancher and he was also a businessman. And my mother's role, she was there side by side with him for more than 66 years. And so I grew up in a home with, imagine a rancher and a military and businessman. You know, you bring out, you're raised with a lot of structure and a lot of discipline. So I carry those with me. I cherish those memories and the work that my parents did to raise me as they did. And then from there, of course, going to high school in a small town, and then from there, just keep moving forward.
So what was it like growing up in a small town in Page, Arizona?
It was great. It was great, but some of the challenges that I still work through today as my job as the Indian Health Service, for example, the home that I grew up in, we didn't have electricity and we didn't have water. The home that is still there today, that was our family home, finally got electricity in 2014. And then still today, there's no running water. So there are still many, many homes on our tribal lands that don't have sufficient sewer and water or even electricity. So as we talk about healthcare and as we talk about public health, those are still factors that are fundamental needs for our people across Indian country.
So you have a great passion for your people, as you said, your culture, wanting to give back. Growing up in Page, Arizona, in a home that had no electricity, no running water, you've been able to experience what you're trying to change. Tell me, clearly that passion comes from your childhood and experiencing it, but what else drives you in getting involved in healthcare and making a change in the community?
Thank you. So there are many, many parts of that great question. First is just the challenges that our people still live with today. I mentioned earlier diabetes. We have the highest rates of diabetes across Indian country. We have challenges with regards to just public health infrastructure that impact our ability to raise up some of our tribal communities to the level that we would like to see them. But part of that was, again, reinforced just recently with the COVID pandemic. It just reminds me of how important it is that we continue to improve our tribal communities with that infrastructure. That infrastructure builds success. That infrastructure builds what we need for our tribal communities to be successful as we move forward. So whether it is broadband, whether it's improved roads, whether it's housing, whether it's food insecurities that many of our tribal communities live with, all of that impacts a person's health. So when we talk about transportation, and if we can't get a person from point A to point B to their appointments or whatever, and not take into consideration transportation, then then we're not addressing the person's need. If we're talking about food insecurities, where many of our families today struggle with that across the nation, struggle with food insecurity. And what do we do about that? How do we build sustainability? How do we build systems back into our tribal communities where we're less reliant and we go back to some of our traditional practices? And so we're seeing this as we move forward. We're seeing that progress across Indian country is being the most successful places that we see progress is where tribal communities are thriving when they go back to their traditional practices. They go back to their traditional foods. They go back to their traditional traditions of the practices of customs for dancing and singing and those kinds of things that are being brought back into their communities. Those are the communities that are thriving the most. And I think that investment, that reinvestment to tribal communities is so important. The flip side of that is also that Indian policies of the history of Indian policies and how they still negatively impact tribal communities today. If you go to just the basic elements of Indian policies that were established years and years ago, they were to eradicate us. They were to do away with the American Indians and Alaska Native people. But as I've traveled throughout, particularly over the last 27 months, to see tribal communities thriving, to see tribal communities say we want to change the outcomes of our community so we can be a healthier community. That has been the best. That has been just an absolute rewarding experience. And there are other places and other areas that we still have to work on. But I think that we are on the right path to make sure that Indian country is healthy.
Well, I'm going to have to agree. You've been at the helm of that will for 27 months. So I'm confident as we move forward into this conversation and hear more about your accomplishments with those Native tribes that we will see that. But before that, I want to ask this. Tell us the why. Why were Native American or the tribal communities placed in this situation? Tell me why this is that it's common for them not to have running water or for them to have diabetes. Tell me the root, the why.
So that's a very loaded question, and I don't feel that I can speak for tribes or tribal leaders in this particular area. But we do know that the lands that tribal communities were moved from was part of it. And what is on that land, those precious minerals or whatever that there was that the government was looking for to relocate American Indian people from their tribal lands to different location. That's one of them. And so as we look at the why of why we are where we are today, you look at just the boarding school era, where many, many, many children were relocated, taken from their families, and placed in government-led boarding schools. We've just completed through the Secretary of Interior just completed a study on this and the impacts. And even though that some of those might have ended in the mid 60s, they're still impacting our people today. The relocation of people taken from their tribal lands and relocated into other places that were foreign to them. Maybe they could grow things in the land that they used to live on, and the new land maybe doesn't support that. Maybe there's not that infrastructure that's in place for that. All of these things you see, those to me lead up to the why. And so when you look at diabetes, when you look at these other challenges that we have of heart disease, we've been working very hard at Indian Health Service about food is medicine. And everything that we take in, it impacts our body one way or another. And so if they are unhealthy, if they are not good, or if that's not what we were traditionally accustomed to eating, then those make a change. Moreover, just the environments that we live in. I've traveled several times to the state of Alaska, and just, again, to understand and appreciate their challenges just for transportation. They have to go. I might be able to fly into Anchorage, Alaska, but from there to get to any village, this has to be by air or by boat. There's no roads in Alaska. So how do we manage that? Not just from a healthcare perspective, but just the way people live. In a recent visit that I had, I visited a small village, about 500 people. And I always like to look in the stores, the little stores. I like to look at how their homes are and how people live. I went into the store and it's $14 for a gallon of water. $14 for a gallon of water. And then right next to it, it's maybe $1.20 for a can of soda. So you look at those options that people have and the resources or limited resources that they might have. If they're choosing the soda because they can afford that, the challenge that creates is by the time children are school age, they need reconstructive dental work. So all of these things that we talk about, and that's why I think from a healthcare perspective, we have to take a step back and really look at those social drivers of health and how those impact the health of our community. Because you can't just deal with the medical side. You can't just deal with the pharmaceutical side and say that we've done our part without looking at what are these other factors that impact that patient and for them to be successful, for them to be where we want them to be as healthy tribal communities. So it's more than just medical at IHS. And when you look at our mission statement, we talk about the physical, the mental, the social, and spiritual health of our people. When you look at it, that's the whole person. And so that does take time as we start to really think about, you can imagine if there's not sufficient housing in a tribal community, what happens? Somebody's worried about that and somebody's going to be impacted by that, and probably less in thinking of their health. So that goes to the bottom of the list until it can't be at the bottom of the list anymore. And then, of course, that has its own challenges with it. So we know that policies across, even policies today, continue to negatively impact our people. But at the same time, we have many, many tribal communities that continue to thrive because they are taking the approach of addressing the whole person and therefore building up each tribal community to be healthier.
I heard you say that it's very important there's current tribes that are thriving now that they're having the opportunity to invest back into their traditions, invest back into the food that was traditionally what they ate prior to being introduced to other food, such as soda or maybe burgers or something along those lines that wouldn't necessarily be in line with the native nutrition that was done in the past or that was participated in the past. My question to you is, what are those foods, one, that you think that are helping the Native Americans get back to their health and those traditions? And then secondly, I wanted to acknowledge that I absolutely agree with you. And I've seen studies. I'm currently getting my doctorate right now here at University of Phoenix. And in those studies, I've actually seen that all of our bodies are aligned to traditional foods. So we're not all supposed to be eating the same thing. A burger for me is very different. Well, my body will handle that very differently than a burger for our producer, or so on and so forth. And so I think that in itself is very important. You're speaking about preventative. Eat this food to prevent having to heal yourself or have medicine save you. Tell me more about the food that the Native Americans are accustomed to that's actually aligning with them staying healthy and those traditions.
Well, there again, there's over 500, actually 574 federally recognized tribes across the country. At the Indian Health Service, being the 18th largest healthcare system, we span about 37 states of where we have those tribes that live in those 37 states, and so again, taking one of those 574 federally recognized tribes and not layering that we're all like this or we're all the same, because we're not. So by regions, perhaps there were different foods that people were more accustomed to than other regions. In Alaska, for example, they rely on the salmon. That was their choice. That was their food. And down in the lower 48, they were different kinds of foods that were traditionally, that our people were traditionally accustomed to. And those, again, back when, they were grown and then they were utilized. And then so so I can't quite answer your question specifically. I can talk about maybe this tribe or that tribe, but what's important to understand is that what I experienced as a young child, and what my what my mother tried to prepare for us as a young child, I wouldn't even say were our traditional foods. She was just trying to put food on a table that she could put together to make sure that all of us 8 children were able to have something to eat at any given time. So I think it's bigger than that. And what I see, though, what I've seen in tribal communities is that each tribe is making those decisions for themselves. What can they go back to? How do they foster that? I've been visiting a tribe in Oklahoma, for example, and they have their own little grocery store, and they put in there what they believe is best for their tribal communities. They put in there. So they don't just go to any grocery store. So they're supporting that tribal community with the healthy choices from a community perspective. And I think that if each community could do that, as opposed to what I explained and what I experienced in Alaska and what I observed in terms of prices and so forth, if those things could be met in each tribal community, that's what's going to drive improvement for that community. Moreover, coupling that with education today, why it's so important that we need to move around, why it's so important for us to exercise or walk or whatever it is. And many of the services that we do at IHS through our diabetes program supports that. Many tribes have taken those resources and built wellness centers or working on building wellness centers. And again, a safe place where people can go to do their exercise or to do their walking, or just to do food lessons. How do you cook with the foods that we have today, and how do you make them healthier? How do you make these quick meals? Because we're all busy, we're all running from point A to point B. So I see that happening in tribal communities, and if each tribal community can really invest in that for their people, it's going to make change. It is making changes in our tribal communities.
That is very powerful. And I want to hear more about your passion for healthcare, because again, in my studies, I've also found that there's, like, in low income African American communities, there's food scarcity. There's less grocery stores, but they'll be within 5 to 10 miles, there'll be 8 McDonald's, 10 Burger Kings, Wendy's, Pizza Hut, smoke shops, the cash advance stores, all of that within a small amount of space, and maybe 2 grocery stores. That in itself is completely destructive for that community. And it is only encouraging them to spend money recklessly and to possibly indulge in tobacco or other things from the smoke shop. And then the same thing with the food. How much cheaper is it to get a Happy Meal or something along those lines, as opposed to going to your grocery store where there's only 2 of them? And to your point, soda is substantially cheaper than the healthier options. You have made some very important moves and changes for your community. Tell me about your passion for healthcare and what steps you have started within this 27 months and completed to help move that forward.
Thank you. So Indian Health Service is part of the Department of Health and Human Services. And through many treaty agreements, through many commitments of the federal government, the exchange for land or exchange for resources in Indian country was dependent on the government providing health care to American Indians and Alaska Natives. That's what makes our relationships with the federal government, each tribal relationship with the federal government, unique, because it is a nation to nation agreements that were had way back when. And many of those agreements, if not all, include a healthcare component. So Indian Health Service is that federal component. We are the lead organization, if you will, the lead government organization that provides that health care for American Indians and Alaska Natives. One of the great things about the Indian Self-Determination Act that was developed in 1975 provides for tribal governments to assume their part of their healthcare system. So since that time, tribes have contracted or compacted their part of what the government used to provide for their tribal communities in terms of healthcare. Again, that self-determination, that self-governance act that tribes have taken now has led IHS to be about less than 40% of IHS remains as a federal government. The rest, or 60+% of the tribes, have taken their portion of the federal government to provide healthcare for their own communities. That is thriving. That is where the change is going to come, is when tribal communities take responsibility for their own healthcare, because they know what is best for their tribal communities. The government can't say, oh, we should do this here for this tribe, or we think that this is going to work for. No, because we're not in their space. We're not in those tribal communities. We don't know how many grocery stores they have or don't have. We don't know what resources that they have or they don't have. So I think as the government keeps moving forward and fostering this relationship with tribal communities and tribal governments, that the more that tribal communities can take responsibility for their healthcare system or for their whole community, that is where they're going to make the best decisions. And I think as we continue to embrace that from the federal government, our role is to assist, our role is to support, our role is to foster those steps that the tribes choose to take. I will say, just the amazing work that is happening in Indian country as a result of self-governance and self-determination in Cherokee Nation, for example, in Oklahoma. We have the first medical school on tribal land. So I wish we could have a medical school in every region on tribal land, but that's the beginning. That's the beginning. Out in Arizona, we have one of the first cancer centers in a tribal community, so people don't have to drive hours and hours to get for cancer care. So we're getting there. They are small steps, and we have a long ways to go. But the more that tribal governments can take responsibility, or when they choose to and when they want to, then they're going to be the catalyst. They are making those changes. They are showing that we can do this work as we move along. And then most of our care is in rural America. Most of our care is in isolated locations where we have to drive 4 hours. When you drive from Fort Peck, Montana, to get to Billings, Montana, if you need higher level of care, it's a 4-hour drive. So you're thinking about somebody that has dialysis. You're thinking about somebody that's a cancer patient and have to make that drive, maybe 2 or 3 times a week for dialysis. How do we change this? How do we really look at creative ways that we bring services closer to the people in their tribal communities? Not just for American Indians, Alaska Natives, for all Americans, that we deserve better health care across the nation. The other thing I would say is that over the years, we sometimes at Indian Health Service, we have made our system more complicated. Navigating the healthcare system today is already complicated, and we don't need to put more layers on that for our American Indians and Alaska Native people. So dialing it back, simplifying it, going back and saying, where do we need to streamline? Where do we need to cut out these layers of steps that maybe our people have to take? Those are really important for us to do. So as I look at healthcare, or as I've looked at it while being in this role, has really been trying to look at it from that patient perspective. During the last part of my father's life, my father was a decorated veteran, but he chose not to go to the VA. He chose to go to his small healthcare facility on the Navajo reservation. That was his choice. And even though I thought you have, the VA owes you this, you're entitled to this. They're entitled to the best care possible, whether it's IHS or the VA or however they choose to do it. So, and then I also went through the same experience of navigating my mother's care as a cancer patient. She had breast cancer, and navigating that for her. But as what I saw with her was, that was during the pandemic, and that opened the door for, even though it was always there, for telehealth or audio health. And so she didn't have to drive as far. We could take a call with her at home, and she didn't have to wait in a car or drive in a car for hours to get to her appointment. So those things are changing as we see technology changing around us, as we see these opportunities to make sure that we have better outcomes or even better experiences for our patients is very, very important. That's what drives me. That's what reminds me that I see that. And then I turn and look at my 5-year-old granddaughter, and I'm thinking, what do I leave for her? What do I want to make sure that my children have care, the best care that they should have. And so they're healthy, not just healthy today, but healthy 20 years from now, 40 years from now, and 50 years from now. So I think all of these things that we're talking about when we're talking about these social drivers of health, what are we eating? What is my responsibility to be an example to her and to my grandchildren about what I eat? Because we give them what we're eating, and if it's healthy, that's great. If it's not, then it's not good, because then we're just fostering these behaviors as we continue to drive. So that's what drives me every single day. The work that I do, there's a face at the end of every patient experience. When I'm looking at policy, when I'm looking at what is it that we're going to work on at IHS, there's a face there. It's meaningful. There's a tribe there. There's a tribal leader's voice I can hear saying, we want this and we want that, and this is the way we want it. So again, it's not so much that we provide the care that way, but we provide the care the way, in this case, our people want it.
Tell me what's up next.
I'll take a little bit of time for myself. I think anyone that has been in these kinds of positions, you need time to sort of just step away and decompress, if you will, just the past that we have dealt with. So I'm looking forward to that. I'm looking forward to getting a little bit of rest. Then I'll decide, what my next steps will be.
Ms. Tso, thank you so much for joining us. And even more, thank you for the 27 months of incredible service.
Thank you. Thank you so very much. Thank you.
That brings us to the end of this episode of Degrees of Success. Don't forget to like, subscribe, and comment. I'm your host, Freda Richards, reminding you that your next chapter might be your best one yet. See you soon.